All right, so we want to talk about headaches in relationship to doing keto and intermittent fasting, okay? This is really a hypoglycemic type issue. It's a low blood sugar situation. Your cells have not yet adapted to running on ketones. You're still running on glucose. And so if you implement intermittent fasting and you try to go for a period of time, it drops to sugar, okay? Now, the problem is that low blood sugars add a tremendous amount of stress to the brain, the central nervous system, and the nerves overall. So it's a tremendous amount of stress. In fact, the brain is the first organ to be affected by low blood sugars, okay? Because they depend on glucose. Now, there is an alternative fuel called ketones, but if you don't know how to do it, you're going to run on glucose, and if you implement intermittent fasting, you're going to crash and burn, okay? Now, headaches are a very common symptom of hypoglycemia, but to really know if your headaches are connected to low blood sugars, all you have to do, as soon as you start getting this headache, is to consume some protein, because that should instantly improve your headaches. If it doesn't, then it could be another source, all right? And there's other videos that I have that explain that. I'll put a link down below. But the solution to the headaches is to realize that it's a blood sugar thing and go into this more gradually. So, for example, if you're doing this at twice a day, you're eating twice a day and you're getting headaches, well, add another meal, because you're not ready to go to 2 meals a day, okay? If you're doing 3 meals a day, maybe you need to really add a little more protein. But again, here's the problem, because medically speaking, what they'll do for hypoglycemia is they will tell you to add more snacks, like 5-6 meals a day, which is a big mistake. Even though you'll feel better, you'll never correct the problem. You might go, wow, I had some fruit, I had some protein, I feel better. But if you're not working towards running your body on ketones, you're still gonna have the blood sugar situation, because as soon as you eat, you're gonna spike the insulin, it's gonna come down. Primarily because it's the frequency of eating that keeps the insulin very, very high. And if you're trying to fix this problem, you want to work towards going longer without snacking, okay? So snacking is just a very quick fix. It's a temporary situation, but we want to go longer without eating in general. And the other bad advice would be to add some candy. I'll show you this right here. Merck's Manual, this is a medical book, under hypoglycemia. First of all, it says the sign and symptoms, headaches are a big symptom of hypoglycemia. Now on this next page, they're talking about hypoglycemia and diabetes, which is a little different than this, but I wanted to mention what they recommend. Diabetic patients taking insulin should always carry sugar lumps or candy with them, and the patient's family and friends should instruct in recognizing these symptoms of hypoglycemia and in giving an emergency treatment mentioned above. Now, I do understand that if it's an emergency low blood sugar situation, to get it up pretty fast, but there's no real questioning on what's going to correct this problem. How do we stop getting in this situation? Because if you're taking a certain amount of insulin and you're ending up with low blood sugars, then why don't we take less insulin so it doesn't drop so far, okay? I'm going to do a whole video on that. But the point is that if you get headaches when you do an intermittent fasting or keto program, realize that it's usually a blood sugar situation. You haven't adapted yet. And yes, if you snack or eat protein, you'll feel better, but you have to really get the big picture and realize that unless you adapt your body to ketones, you'll never fix this issue. All right? Thanks for watching. Hey, before you go, definitely sign up for my free keto course. I put a link down below. It's on Messenger and Facebook, but it will give you all the basics. It's very quick. It's like 3 or 4 videos, and it's free. Check it out.